At 4 in the morning, a hospital in Columbus, Ohio looked peaceful from the outside, but inside it hid one of the darkest betrayals the state had ever seen. Hospitals are places where people lower their guard. Parents bring their children there. Elderly patients trust doctors with their final years. Families sign forms believing those signatures protect life. That trust is quiet and powerful, and for 9 years it was used as camouflage for something cruel. What unfolded inside this hospital was not a random crime. It was a system built patiently, protected by silence, and powered by money. The morning everything broke open started without warning. Federal agents moved through empty streets while most of the city slept. The private hospital parking lot was dark, with only a few lights glowing near the entrance. Inside, the hallways were still. Then the doors burst open. FBI and DEA agents entered fast, controlled and precisely. Their boots echoed through corridors meant for healing. Radios crackled. A building designed for safety suddenly felt dangerous. Agents headed straight to the second floor. The hospital director's office was locked. There was no knocking and no discussion. A steel hammer struck the door until it gave way. Inside, the room looked ordinary. There were framed photos, flowers on a shelf, and a clean desk. Everything suggested professionalism and care. Then agents moved to the back wall, where a heavy safe was hidden. Cutting tools bit through thick metal. When the door opened, the mood changed completely. Inside the safe were 12 kilograms of fentanyl, stacked and sealed like bricks of currency. There was also a firearm and a secured phone. This was not a mistake or a misunderstanding. This was preparation. Minutes later, the hospital director, 48-year-old Amina Hassan, was placed in handcuffs. Her white lab coat hung loose as nurses watched in shock. 9 years of trust collapsed in a single moment. What investigators uncovered next was worse than drugs alone. The hospital had become a pipeline. Every week, fentanyl and heroin entered the building disguised as medical supplies. Boxes arrived late at night with perfect labels. They listed gloves, gowns, and equipment. Inside were bricks of pure drugs. Staff never used street language. They called it special weight loss medicine. The phrasing sounded harmless. The reality was deadly. Financial records exposed the scale. The hospital ordered nearly 10 times more supplies than necessary. Midnight shipments appeared like clockwork. No alarms were raised because everything looked official. Patients continued to arrive. Children came for treatment. Elderly people came for tests. Workers trusted the hospital with their lives. Behind clipboards and polite smiles, a second business grew quietly and effectively. Amina Hassan was not managing healthcare. She was running a distribution hub. The hospital provided protection, and patients provided cover. The entire operation survived on one belief that proved true for years. No one suspects a hospital. What investigators found next shook even experienced agents. The fentanyl was not the worst discovery. The hospital had learned how to end lives legally on paper and remove organs without suspicion. Victims were chosen carefully. They were elderly patients without family, homeless individuals brought in unconscious, and accident victims sedated before they could speak. A hidden operating area existed inside the hospital, missing from official maps. A narrow corridor led to bright lights and metal tables. This was not a place meant to save lives. Patients were marked critical shortly after arrival. Within an hour, paperwork declared them unlikely to survive. 2 signatures approved emergency organ donation. Many patients never regained consciousness. Bodies were logged as numbers, with no names, consent, or families listed. Records revealed the scale. 315 surgeries were logged over 9 years, many without death certificates or burial records. Causes of death were vague and avoided mentioning organ removal. Harvested organs moved through cold storage in containers labeled as donated medical material and left the building unnoticed. The money trail exposed the final truth. Payments flowed through routes linked to international cartels, including CJNG and Sinaloa. This was not an isolated crime. It was a global trafficking network operating inside a place meant for healing. Once Amina Hassan was in custody, Agents understood the hospital was only the center of a much larger web. Maps in federal command rooms lit up with locations across Ohio: clinics, warehouses, financial offices, private homes. The order came quickly and clearly: strike everywhere at once. Before sunset, unmarked convoys rolled through cities and small towns. Armored vehicles appeared behind clinics. Helicopters circled above frozen streets. At one private clinic, agents forced entry through the back door. The waiting room was empty. The basement was not. Locked refrigerators held sealed containers. Labels said medical samples. The smell of chemicals said otherwise. Surgical tools lay cleaned and ready, waiting for the next procedure that would never be legal. At a warehouse near the river, the operation turned violent. Armed men waited behind crates. When agents approached, gunfire erupted. Bullets struck metal and concrete. Sparks flew. Agents took cover and responded with discipline. A flashbang exploded through a side window. The room was filled with light and sound. The gunfire stopped. On the edge of the city, a refrigerated truck tried to flee. Its engine roared as it smashed through a gate toward the highway. Federal SUVs accelerated and blocked its path. Tires screamed as the truck skidded sideways and stopped. When agents opened the door, they found boxes of cash and sealed medical coolers. Inside the coolers were human organs wrapped in plastic and ice. The arrest spread. At the home of a police officer, agents found large amounts of cash hidden in ceiling tiles. At a bank director's house, they found safe deposit keys and documents showing offshore accounts. Names filled whiteboards. Each hour added more connections. By nightfall, dozens of people were in custody. Trucks filled with drugs, weapons, financial records, and transplant files. Ohio woke up to sirens and flashing lights. The truth was impossible to ignore. A hospital had been the center, but the disease had spread far beyond its walls. The institutions meant to protect life had protected crime instead. As the investigation deepened, it stopped looking like a medical scandal. It looked like a system. To survive for 9 years, the network needed protection at every level. Files taken from Hassan's office listed names that shocked investigators. Judges, police officers, health inspectors, bank officials, community leaders. Some names were written clearly. Others appeared as initials with numbers. Every name had received money disguised as consulting fees, special services, or charitable grants. Agents followed the money carefully. It began with hospital accounts, moved through non-profits, and vanished into shell companies that existed only on paper. The signatures belonged to real people who were meant to protect the public. A judge approved emergency transports without review. An inspector cleared late-night shipments. A police officer erased records. A bank director hid money under multiple names. Each action seemed small, but together they formed protection. Within days, investigations spread across Ohio. Judges were questioned, police reopened files, and banks reviewed all transactions. Trust in institutions began to collapse. Hospitals had always felt safe. Seeing a trusted figure in handcuffs shattered that belief. Emergency meetings followed as hospitals reviewed records and shipments. Some supplies were clean, others raised serious questions. The governor ordered a statewide view of every medical facility. Thousands of records were examined, and a hotline was opened for families seeking answers. Investigations expanded, but fear lingered. Once trust breaks, it leaves a lasting scar. By the third day, the raids ended and the tape came down. Evidence was boxed and agents moved on. What remained was heavier than any seizure. It lived in the people and did not fade quickly. Communities spoke about trust more than crime. The greatest damage was not the drugs or the money. It was the loss of certainty. Yet one truth remained clear. The network fell because agents followed the evidence without fear. FBI and DEA teams worked through the night and stepped into danger so others did not have to. Justice continued through accountability, awareness, and refusal to stay silent.